Hi, welcome. Welcome. My name is Susie Schultz. I'm the Executive Director of the Museum of Broadcast Communication, and I'm so glad that you're here with us today, whatever day it is that you choose. We're live with this, but sometimes people catch us on the recording. So here's to you for a happy half hour. And I am also going to bring in our famous NBC chimes. This is an original set of chimes from NBC. It's one of the many wonderful things that we have at the Museum of Broadcast Communication. And as we all know, though the museum and all the rest of the museums in the state of Illinois are closed, we are trying to stay safe and stay healthy and stop the spread of COVID-19. But you can catch some of the work that we do not only here on our Facebook page, but also online as we have an exhibit kind of pertinent to the time, and it is called The Great Debates. If you don't know about it already, it's up, greatdebates.org, and it really talks about the impact of the broadcasting world on the presidential race. We have a timeline there that we have kept up to date, and it really goes back 100 years, but we are also talking about, not only the election this year, but the election week, because we know it wasn't an election day, it was an election week afterwards. And we have eight modules of curriculum, as well as a number of articles by by a journalist, Andrea Stone. And we're hoping that this is not only for students in high school and middle school, but also lifelong learners, where we can really look and examine what is the effect of this broadcast industry on so many aspects of our life. So today, we are very, very lucky. We have landed Dr. Emily Landon one more time. She's been a guest here before, and Dr. Emily, you are at the University of Chicago. You specialize in infectious diseases, and perhaps you could tell us just a little bit more so everybody knows. But I think they've seen you on television already.
Maybe so. I'm an adult infectious diseases physician, and I am the hospital's epidemiologist, the chief epidemiologist for the University of Chicago Medicine. And I've been working very closely with the hospital and with the university on our control and management of COVID plan. And I've also been helping to advise a lot of other organizations, including the state of Illinois.
Oh, that is wonderful. We're so grateful for your work. And part of me wants to just start with a little general thing. So what's going wrong here? We clearly have gone in the wrong direction. We don't necessarily want to play a blame game at all, but clearly things have gone wrong.
No, this was largely expected. So the biggest piece here is that when the air gets colder, it can't hold as much moisture in it. And that
Mhm.
moist, warm, humid air actually keeps our respiratory droplets juicy. And that means that they fall to the ground a lot closer to us and they're less likely to be airborne or aerosols that can travel further. And we spend a lot more time outside. But as the air gets colder, it gets drier. Those droplets tend to be smaller. They are lighter. They can go further. They can last longer in the air. And then we spend time indoors where we really do not have ventilation systems that are meant to clear out viral particles and these droplets from the air, meaning that what was okay in your backyard for a barbecue is not okay in your living room. And that's a really hard thing for people to catch on to. And so we see people doing more things that we would say are very high risk, but with less understanding, sort of not necessarily because they didn't. Nobody's being malicious. I don't think. Certainly, there are some people who are really denying COVID and saying that it's a hoax, but a lot of people are doing their best, and it's just really hard to sort of ramp up again with even more protections, um, even less work being able to be together at a time when we're usually used to being together at the holidays.
Right. And so we stay home and we work from home and we have our family
Yeah.
all around us, and, which is a wonderful thing, not a problem at
Yeah,
all.
you
We
can
do
hear
not
my
care.
family. You can
Yeah,
hear my
yeah, we
family
don't.
making noise in the background, and you're about ready to see a puppy. I think that is about ready to get dropped into my lap.
Well, that is exciting news, and I'm going to tell you that none of us are going to mind seeing that at all. A
No,
puppy is something that makes us happy.
he's been pretty helpful in my life. He's brand new. We got him at Thanksgiving. His name is
Oh my
Stitch, and he is a poodle Shih Tzu mix. And we're really happy to have him here. He's a pretty good boy. He's gonna sit in my. He's been a very good nappy dog during meetings, so he's gonna hang out here with me.
Oh, that is
And I
really
think
lovely. You need a
And
little lap
I
dog.
think
That
I have a son who wants a hug and a little cameo appearance.
that is okay. That
There
is
you go.
wonderful.
Because he's running out the door. So, this is what you get at 3:30 on Friday.
It is not a problem. It is not a problem at all. We're lucky to have you and your whole family and the dog. I have to say that's one of the things that's kept us sane is the dog. Getting to walk it, getting to do stuff, getting to be with them. It's a great mental health tool for all of us. I wanted to ask though, we are in that in between time. We just finished Thanksgiving, and we're moving to a holiday season. People celebrate a variety of holidays. We started with Diwali before Christmas, and we're working through Hanukkah, Kwanzaa, all sorts of other holidays that we will be celebrating. It's a time of year, as we end the year, where people get together. That's what is the norm for us at a time right now where nothing is normal. Um, we didn't do so well. Again, I guess I'm sounding like the judgmental one on this, but we didn't do so well at Thanksgiving. The airports were a little bit too crowded to say that we did. Where do we think we're headed right now with where COVID is going?
Yeah, I think that sometimes pictures from airports can be deceiving. I think it's hard to know exactly where we are or where we're not. We're starting to see a real bump up in numbers across the entire United States, but Illinois is starting to see a plateau. And I'm hoping that that sticks. It's also happening in Wisconsin and in the Dakotas. And I think that's really important for us to keep in mind. It is possible to control this virus. And I think a lot of people were getting the message, especially in the Midwest. He's a little squirmy, especially in the Midwest, that there were just too many risks for our healthcare system when we were not following all the guidance, when we weren't taking it as seriously as we wanted to. I know everyone's tired. I am exhausted. I am
Mhm.
sick and tired of sitting in this yellow chair and telling people about COVID. But I think I think people are willing to do, especially here in the Midwest. I think people really are just willing to do what it takes to get it done. And I think that individuals across the country are going to be that way. And I think, unfortunately, some other areas that were maybe not hit so hard right before Thanksgiving may be getting hit now. And there's still a chance that we'll see a bigger surge on top of a surge, as Dr. Fauci was putting it, in the next coming couple of weeks. But it's really too soon to tell. We don't know whether or not people's behavior was bad or not bad. And we'll see what that means for Christmas. If people were really, really restrained and careful over Thanksgiving, then it may mean a little bit more freedom for us over our Christmas or our other winter holidays. As you rightfully point out, you can see I'm a Christmas household, but
Right.
certainly Hanukkah and Diwali, and I think Diwali actually is pretty much. I think we've already had that,
It's
but
over. I think it's really over.
yeah. But Kwanzaa,
But
being able to
Kwanzaa,
gather at those times are really important too, and they're maybe a little bit more open. I don't think anybody's going to be having any big family gatherings this year, unfortunately. But maybe, maybe we'll be able to get together with just my mom and my son and I and my sister. Would be something that I'm hoping is going to be reasonable if we are really careful about our contacts leading up to the holiday. That may be a possibility
right.
for us.
We have had, again, I'm devolving into kind of the negative stuff, but bringing it up to you actually is rather comforting. You give it perspective. We've seen a number of headlines where there have been, weddings. They're wedding at one of the hotels on the North Shore. Weddings that where we have at the White House. We have a Secretary of State who's invited 900 people to come to a party, a holiday party, and that's only one of two that he's planning on throwing. So um, that's a to me that's a very hard mixed message for public health. And I think that I would love you to actually give us the message that is really important as we approach the holidays. What should we be doing?
Well, first of all, I think it's really important to remember that public health officials and medical physicians and people in the healthcare field, we haven't given up on controlling this virus. We know that it is possible. We also know that vaccines are on the way. They're going to be here soon. It's not going to be soon like next week. It's soon like in a few months. And I know that feels like the end of the world right now because we're heading into the holidays, but people in the past have weathered real hardships in their lives, wars, real depressions, horrible things. And we can weather this too. I think it's extremely disappointing that our leaders, our elected officials that are in the White House and appointed by our president right now have decided to give up, that they have chosen denial, and to just let it take its course. That's never been the American way, and it doesn't need to be the American way, and it doesn't have to be the way for your family. It can be, we can be careful still. It is not the end of the world. I know it's hard. Kids are out of school, they're in virtual classes, they're suffering, we're all suffering. But these are hardships just like what other it's hard because they didn't need to be that way. But the bottom line message is that it doesn't need, this is the end of the road. It is, it's not going to be easy. It's not going to be completely over, but this is the hardest time we're going to have to go through together to get through this. After this, things are going to start to get easier. And I think that's really important to remember. So these dark
I
winter days, just make it through.
Yeah, I liken this to way back in college, as we know that was a couple of years ago. I was on track and I used to run the 880, one of the most ridiculous races in the world. It's not a sprint, it's not a long distance. What is it? But so you have to really pump it. And in this 880 race that is COVID, which actually feels more like a marathon, I feel like we're
That's a
we're at the
bit more
600.
like an Iron Man.
It's a
I mean,
little bit more like, yes, it is. But in my
yeah,
analogy, we're at 600, right? And we can see that finish line. We just got to pump it a little bit further. We just got to get across, and we've got to hold on and find a little bit of strength to do it. And I do want to circle back and say you were so right that yes, we have leaders in the White House are doing it who are not sending the right messages. But I also want to be clear that this goes across partisan lines because we've also seen in the last week,
hmm
Democratic officials who have said to constituents one thing and then turned around and gotten on a plane to go on vacation when they told everybody else to stay home. It is. I think you're so right. This time where the pot has been boiling, and we're just ready. We're just ready to go, but we got to hold on. Um,
Yeah, but the
we
message isn't to give up, no matter how hard it is. And there are certainly a lot of people for whom it's been too hard, and they've made decisions that I don't think are really honorable. The great news is that a lot of people have come forward and said, "I regret that I did that. I shouldn't have
right.
done that." And that's such an important lesson, because if you have in your family gave up in some way, or took, just said, "I can't do it anymore," you can come back from that, and you can double down now and be extra careful. There's no need, if you got lucky, right? If you had a big Thanksgiving gathering and no one got sick and no one gets sick in the next few days, and you say, "Wow, I really escaped. That was a near miss." That's how I would see it, a near miss. And now is the time to buckle down and say, "We should not have done that. Let's be more careful going forward."
Yeah, there's exciting news. It does get you to feel very excited when you see things going on in England, where they're going to be distributing this vaccine very soon. We Several late night comedians have referred to them as our English guinea pigs, but but we are very grateful that they're going forward and going ahead, and that is exciting. There's a few things that we all can do, and I know at the museum, one of the things we want to do is we want to help a little bit. We want to give and do our part. And we're going to be kicking off in another week. I think I was just telling you about this, a campaign that we called NBC Stay at Home for the Holidays. And what we're
Mhm.
going to do is we're going to ask people, and I think you have kindly volunteered with your family and your dog, and for people that we know and voices that we recognize to read us stories and tell us about their celebration of the holidays. And we're going to be streaming that online here on Facebook, and we're excited about that. We'll have more information here on Facebook for those of you following us, for those of you watching this, and we're gonna have about a 2 week window where we do nothing but say, listen, stay home, let us help you, we're going to try to make sure that we give you a couple minutes of something that might surprise you, something that might delight you, and something that the whole family can kind of sit around for a couple of minutes and enjoy. So,
I would love to participate. I think that sounds great. I think it's akin to some of these great ideas that some friend I've been invited to a gingerbread house decorating party where I've been sent a gingerbread kit, and I've been asked to put the house together so that by the time I come to the party, I or do it the night before, and then we can decorate them all together over Zoom. And we're looking for some really creative things to do for our holidays with our team at work. There's a lot of great things to do, and I think it's the right time of year to really just relish in the fact that you don't have to get out of your pajama pants.
You really don't. It is really. I was actually doing a panel for a national conference, and I felt guilty enough that I had to admit I'm so pleased to be here and barefoot at the same time. But I think that too, and I know that it sounds like we're being very light on this, but I want to be very clear. Um, that, especially those of us who are able to make these decisions about holidays, some of that has to do with the fact that we may be privileged that, death hasn't touched our lives or our families. But that death toll is climbing. It is, and the numbers have been very scary. I'm the predictions are numbers that I don't even want to get into because they're, doubling, tripling, whatever as we go through. So, what is it we can also do to try to wade through the news and information? Because it is, it was part of it is either you turn on the television and you're watching news and you can get addicted to that. We've had moments of trauma where experts have basically said, turn off the TV. And right now it's all still election issues and COVID-19. What do you recommend for mental health?
Yeah, I think this is really tricky. I think first of all, it's important to recognize that those of us who can do work from home or stay home, the more we can stay home, the easier and safer it is for essential workers that do need to be out and about in public transportation and things like that. So don't make unnecessary trips or things right now. I know it's the time of year when there's a lot of things that are traditional to do, and if they're, choose the ones that are most important that are safe for you and your family to do. But otherwise, I think it's probably a good time to sort of gather around your home. And I think it's really hard to deal with all of this stuff, but I think it's
Mhm.
also really easy to get desensitized to the numbers when you see them on TV a lot. And it seems somehow okay now that the same number of people, I'm going to guess that today we probably lost about 3,000 Americans to COVID. And that's the same as what we lost on 9/11. And it doesn't feel the same way to us that it did
Yeah.
then. And I think that's really important to recognize. I think the first thing to do is to acknowledge in yourself that that you're sick of this, that you've been desensitized to these numbers, that you can't really fathom it all. And I think that's really important to acknowledge because your decisions about what you do and how you live with your family are colored a lot by how you handle this. And just saying to yourself, I can't fully understand what this means. This is taken away a lot of things that matter to me, and for other people, it's taken away people that matter to them. And it's
Right.
really hard for me. I can't figure out how to equate my grief and fear over the things that I've lost with the things that they've lost. And you can't. You just have to let it be that you can't, and then take time
Mhm.
for yourself. Self care. We have our new puppy. Find things that you do enjoy, and I think it's so important. Everybody's tired of Zoom and video calls, but that doesn't mean that it's bad. For Thanksgiving, we had Zoom with my family over Thanksgiving, but I also invited a lot of my close friends from around the country to just stop in. It was like a Zoom open house. I sent them the link and said, "Stop by for 5 minutes between 3 and 4:30." And
Oh,
it was great to get to see people that I would never be able to see at Thanksgiving. It was wonderful to be able to just say hello to people that and see that you just text with, that you don't otherwise see. And so it was like a way of feeling that Thanksgiving was even more expanded, even though we weren't really expanded at all. And I think taking advantage of those things, don't blow off the Zoom parties and the mixers and the virtual things that people are planning for you. Some of them might be really cool, and it's important to get that social interaction. It's not just another meeting.
I think I couldn't agree more. I'm gonna show you something. This is my friend.
Oh, look, it's puppy
This
day.
is my
Oh my
this is
gosh,
my
he,
friend Dean. Thank you. Yes, I love
hi.
you. Yeah, thank you so much. He's the one who
He's so cute.
he's 11. He's not a puppy,
Oh my goodness.
but he is still walks with us. We try to walk about 4 miles every other day, and he's pulling me along all the time. But that is again something that actually gets us outside, gets us breathing.
Yeah.
A little bit different sights. That helps us tremendously as well.
Yeah,
Um,
Susie, you have it right there. Getting exercise and getting outside. Now this is a great year for really sort embracing the whole Scandinavian way of thinking about these things, which is that there's nothing wrong with the weather. There's only something wrong with your clothing. So get some stuff, get some warm weather apparel and go for walks. Do geocaching. Find a way to get outside and enjoy the winter. Don't just stay cooped up at home. But if you can avoid being indoors with other people, that's really important. But outdoors is great. Bring
so
some
one
hot
other
chocolate in
topic
your swell bottle.
that I think I could that would be persuasive. One of the other more serious topics I wanted to just touch on a little bit is that vaccine that's coming, and it looks as though it will in Illinois. We might actually even be getting it in the next month or two. Then going to first responders, and I wonder doctors and I think it is what the CDC has decided that it will be doctors as well as people in nursing homes, right? Long-term care nursing homes. Is that correct?
Yeah, so it's
Was
it's
that the
not just doctors. It's any healthcare worker with direct patient care contact where they may come in contact with patients or stuff that may be contaminated with COVID. So that includes even environmental services workers, dietary workers, social workers, laboratory workers, nurses, doctors, uh, physical therapists, everybody in the healthcare setting, both clinical and in the hospital, as well as everyone that works in a nursing home and then nursing home residents. That's what the 1A category is. And it includes I think we're looking at probably about 30 million people. That's a lot of people that need to be vaccinated. But there are plenty of doses for that group. Now, there's also more doses being made every day. Illinois is going to start seeing vaccine at the end of next week. It should be arriving in the public health departments, and we expect to start vaccinating the following week.
That is amazing. Let me ask
Mhm.
you. There are campaigns right now. We have three presidents who have been former presidents who are volunteering to be vaccinated on television just to calm us all down. Bush, Clinton, and Obama. And is there a what have you noticed among your colleagues? Is there is there any reticence about taking, or are they nervous about, or where do you think
Well,
the medical community stands on it?
listen, the data that's coming out from the two first vaccines that we're going to see, and there are going to be a lot of vaccines, but the two that look like basic sure things right now are the Pfizer vaccine and the Moderna vaccine, and they're both made a very new way. And so they're a new kind of medicine, which makes everybody sort of think twice about it. But it has an extremely short half life. It is not, there were no real bad adverse effects and that sort of like big things that really harm you or cause long term damage. None of that in any of the trials. There is a lot of feeling kind of yucky after your second dose, feeling a little headachy, having a little fever, maybe feeling fatigued and sore. That's really good. That's your immune system responding to the vaccine. And we've been working really hard to help our healthcare workers understand. Most of the people that are in a position to really understand and know the data are feeling really confident, myself included. And we're really ramping up to be able to vaccinate as many people as possible. I don't know what I don't. Certainly, vaccine hesitancy is a real thing, and I can understand why people would be concerned. But the data that I've seen looks really promising. And if I see something that makes me feel like it's not a good idea, I will, say that right away. But so far, I just looked at all of the emergency use authorization data, which gives you a lot of insight into what actually happened in the trials and what the United Kingdom has decided for their emergency use. We got access to those documents, and they are very reassuring. A lot of people feel not awesome, but everyone says it's worth it. Worth it to not feel great for a day if you get to avoid having COVID. And the outcomes are really good with these two vaccines. And there's more different mechanism vaccines coming down the pike afterwards. With lots and lots of different vaccines, we'll be able to patchwork enough doses to get a lot of people vaccinated pretty soon, relatively soon, in a vaccine type of thing. It's important to know, though, that many of them require 2 doses, and you're not really immune until you get the second dose. So it takes about 6 weeks, so 4 weeks for the second dose, and then another couple weeks after that to really be immune. And even then, some people won't be, and it's not clear exactly who's going to be and who's not going to be. So we'll still need to wear masks and things for a while. But I think as more and more people get vaccinated, we'll start to see life returning more to normal.
So I think that many people wonder. I know the museum industry, for example, is wondering what are the shadow things that will follow us? What is it people will feel comfortable doing and won't feel comfortable doing? Will they still want to deal with touchscreens? Will they still want to actually go places? It's something we don't know yet. As an immunologist, what are the things that you would like us to hold on to? What are the habits that you think are vital once we get past this, if we were acting in for our better selves and better care, that we should continue to do?
Well, there's a lot to learn about these vaccines, and a lot to know still about how much they're going to protect us and what they are and are not going to do in terms of providing sort of protection. And so in the beginning, it's going to be really important. We're going to have to stick with masks and the layers: masks, distance, ventilation, eye protection, decreasing your contact, washing your hands, and then vaccine is another layer. And that layer can make you have a lot of, if you're one of the first people vaccinated, it might make you feel a lot of personal a lot of relief, and it may make you feel very good about yourself. But we still wonder if these vaccines are going to protect people from getting sick, or just protect them from getting symptoms. And so could they still pass it on? So we really do need to get a lot of people vaccinated before we change things. I think we're going to see probably masks in the winter a lot. I think we're going to see better hand hygiene and more hand sanitizer products available around things like touchscreens and stuff like that. And I think crowding is going to be more limited. I think people's tolerance for crowds may be lower than what it used to be. I mean, we would pretty much pack in places without even thinking twice about it. And I think
Right.
now a lot of people, that's not, my idea of what's too crowded has changed, and it's much lower than what it used to be. So for what it's worth, I
So,
think
and
those habits may stick.
I think we are never going to be the huggy society again, which
I
is
don't know. Hugs are not that risky, especially if you're wearing a mask. I think handshakes may be out, but I think, you can still hug your family. Certainly, I would not feel uncomfortable hugging my mother as long as we were both wearing masks. It's when you're unmasked that close contact is really risky. And I think, I don't know that we'll be a huggy society, but I don't think we need to take hugs out completely.
Well, I thank you for that. I deeply, deeply appreciate it. Well, thank you so much for joining us. And for those of you who have joined us, we are going to see Dr. Linden again, because she is going to come back to be part of the NBC Stay Home for the Holidays campaign that we're going to be launching in the next week. It'll be 2 weeks out from the end of the year, and we're very excited that we'll be able to offer you some wonderful people like Dr. Landon, talking about why it is important to stay home, but also what are the things that are important to them at the holidays. And please join us again here next week for the Happy Half Hour. We're so grateful that you joined us. You take care, you be well, you stay safe, and wear that mask, please.